supplement in the Journal of Perinatal Education in the winter of 2007. Those of you who are here, there are copies of the journal you're welcome to have at the table in the back. And those of you who are listening at home can download it for free at www.motherfriendly.org, the entire issue. So the principles of the Mother-Friendly Childbirth Initiative are the normalcy of birth. A woman's confidence and ability to give birth and to care for her baby are enhanced or diminished by every person who gives her care and by the environment in which she gives birth. A mother and baby are distinct yet interdependent during pregnancy, birth, and infancy, and their interconnectedness is vital and must be respected. Again, I'm just giving you a highlight. Empowerment. Autonomy. Every woman should have the opportunity to have a healthy and joyous birth experience for herself and her family, regardless of her age or circumstances. She should have the right to give birth as she wishes, in an environment in which she feels nurtured and secure, and her emotional well-being, privacy, and personal preferences are respected. Do no harm refers to the care that is provided to her. Interventions should not be applied routinely during pregnancy, birth, or the postpartum period. And because many standard medical tests, procedures, technologies, and drugs carry risks to both mother and baby, and should be avoided in the absence of specific scientific indications for their use. Responsibility refers again to care providers and birth facilities. Each caregiver is responsible for the quality of care she or he provides, and maternity care practices should be based not on the needs of the caregiver or provider, but solely on the needs of the mother and child. So based on these philosophical principles, the 10 steps were then developed, the recommendations. The Mother-Friendly Childbirth Initiative is endorsed by major maternity care organizations, ACNM, A1, Birth Network National, Childbirth Connection, DONA International, the International Childbirth Education Association, LALAZ International, the Latin and Radio Child Center for Healthy Mothers and Babies in Florida, and many, many more. So, the Mother-Friendly Childbirth Initiative, which was drafted in 1996, is actually aligned with current quality improvement initiatives. For example, the Healthy People 2020 goals to reduce maternal and infant mortality, to reduce cesarean sections, to increase VBACs. Also, to the March of Dimes, the national campaign to reduce elective inductions and cesareans before 39 weeks. It's also aligned with the current Joint Commission recommendations to lower the cesarean rate for low-risk first births to 15% and induction rates to 5%. So those are the new guidelines. Also, the Michigan Hospital Association Keystone Center Obstetrics, which includes almost 75 hospitals. They are working to reduce inductions, cesareans, epidurals, and the use of vacuum and forceps. The Sutter Health Association in California is working to reduce episiotomies, elective inductions, cesareans, postpartum hemorrhage. Again, examples of these are in your packet. So currently, the Patient Protection and Affordable Care Act, which is law right now, underscores the importance of patient choice and engagement with their provider in their own health care, accountability for providers' care practices, consideration of patient preferences, shared healthcare decision-making, support for women's choice for midwifery care and birth centers, and insurance guidelines now support breastfeeding. Again, legislative initiatives reflect the philosophical principles of the MFCI and some of the recommendations. And these are just a handful of them. Partnering to Improve Maternity Care Quality Act, Moms for the 21st Century Act, which you've heard about before, the Maternal Health Accountability Act, and the Quality Care for Moms and Babies Act. So what are the benefits of mother-baby-friendly care for mothers and babies? Well, if you were to adopt one or more of the steps that are recommended, you would have fewer maternal and newborn complications, fewer maternal and newborn infections, fewer maternal and neonatal deaths, increased maternal-infant attachment, increased breastfeeding rates, improved mental well-being for mothers, fewer rehospitalizations, and safer subsequent pregnancies. And what are the benefits of mother-baby-friendly care for the care providers and for hospitals and birth centers? You would have patient satisfaction and compliance with quality improvement goals that are in place right now, a bonus for high-quality outcomes, a lower risk of malpractice liability, a reduction in malpractice premiums, care provider satisfaction, and lower costs of care. So with regard to improving maternity care, the train already left the station. Everyone is on board. Federal and state health departments, hospital systems, physicians, midwives, nurses, educators, patient rights groups, payers, private and public, corporate business groups, consumer advocacy groups, and quality improvement groups. Will you be left behind? Thank you.